Thank you so much for sticking with us on Live Impact News. I'm Siobhan Riley. It is so great to be with you. We are going to keep the conversation going about fibroid awareness. For those of you just tuning in, we have been talking about fibroid. July is Fibroid Awareness Month, and we are joined by two doctors. We have Dr. Parson and Dr. Bates. Thank you so much for being with us today.
Hi, thank you
Hi
for
there.
having us.
Thanks for having us.
Fibroids, it affects so many women, and those numbers are a lot higher when it comes to African American women. First of all, for those who are not familiar with fibroids, I will start with you, Dr. Parson. Tell us what are fibroids?
Fibroids are a benign growth tumor of the uterus. You have a muscle layer of the uterus that can develop these benign growths in that layer. They can cause bleeding, pressure, and pain for women, and they can grow quite large and be quite impactful for women.
And Dr. Bates, fibroids, it affects so many women, and those numbers are a lot higher when it comes to African American women. Can you tell us about some of that data when it comes to women in general, especially when it comes to African American women?
Absolutely. So while we haven't been able to pinpoint one thing that increases the woman's likelihood of developing fibroids, we know that there is absolutely some degree of genetic impact. We know that there are a lot of environmental factors that play a role, and whether that be diet, environmental exposures, we know that hormones and our weight also play a role. Stress can absolutely increase your risk for fibroids. And then we know that there's some link between vitamin D deficiency as well.
And we do know that uterine fibroids, it affects 20% to 80% of women by the age of 50. And according to data, Black women are 3 times more likely to develop them at some point. Why are those numbers so much higher when it comes to women of color?
We're not sure. We know that Black women have upwards of 75% of Black women will have a fibroid in their lifetime. And again, as Dr. Bates said, it's multifactorial. Genetics is a huge player in this. You will talk to women and they will say, my mother had fibroids or my sister had fibroids. You'll also see that if a woman's mother or sister had large fibroids, maybe she has large fibroids as well. So genetics definitely plays a part in it. But again, diet, overall health can play a part of this. And then environmental exposures can also contribute to this. But we're not sure why it is that Black women are disproportionately affected by this.
And Dr. Bates, I can speak firsthand, as I mentioned earlier in the show, because I have definitely dealt with fibroids. It is very painful. It is not fun. Talk about some of the symptoms of fibroids.
So, typical symptoms range from causing heavy periods, more painful periods. Depending on the size and location of the fibroids, they can start to press on other structures in the body. So, if they're bigger towards the front, maybe they're going to make you urinate more frequently. They can impact your bowel habits, reproductive ability as well, and fertility. So, it can depend. There's a wealth of symptoms associated with a fibroid.
I know that it used to always be get a hysterectomy, but now we know that there are so many other procedures out there. And a lot of times when I speak to women, especially Black women, they are so discouraged because it's always the first thing they have heard in the past, get a hysterectomy. And some have went forward with it. Talk about some of the other procedures out there that can really help these women dealing with fibroids.
Sure. So there are a lot of less invasive options to manage fibroids. We have radiofrequency ablation, where we are targeting the individual fibroids and heating up that tissue to shrink them down in size. There's uterine artery embolization procedures, and Surgery-wise, there's fibroid removal options as well before you get to having a hysterectomy. We also can think about medical management, meaning there are certain medications we can take, such as birth control, myfembry, that make a big difference in symptoms. And then again, back to the impact of lifestyle, diet and exercise make a big difference on how severe your symptoms are oftentimes.
Really good advice. Dr. Parson, talk a little bit about the women who are coming into your office. What is their biggest concern right now?
I think there's a couple of things. I think one, symptoms, how impactful it is to their life. Is it a lot of bleeding, anemia, chronic fatigue? Women get used to feeling poorly. And so really wanting to advocate for them that we don't have to continue to feel this way out of fear that the only option is hysterectomy. So I'd say one, symptoms. And then I think two, their other concern is going to be the options. What are the options to feel better that also could preserve their uterus? I think that would be the second biggest question that we're getting, is exploring the full spectrum of options.
And it's so important for people to know they are not alone. I can think of so many women I've spoken to. I used to think for years, I felt so much pain. I just thought that was normal.
Yeah.
Just stress the importance of women knowing they are not alone. They do not have to suffer in silence.
No, 75% of Black women will have this. And again, many of all women, upwards of 50 to 65% of all women will have fibroids. So it's very common. And knowing that you have options, seek your provider, talk to them about your symptoms, about your options, because you don't have to continue to feel that way.
That is so true. And Dr. Bates, talk a little bit about what advice would you give to women who feel like they have lost hope? Because as we talked about earlier, fibroids can be the most painful process. Some days it can be hard to get out of the bed. So what would you say to those women?
I would say keep fighting, keep going until you find that physician, that healthcare provider that hears you, knows what is most important to you, and values the same thing with you, and who can really counsel you in the right direction. Social media has really started to increase awareness around fibroids and management as well. It can be good and bad because sometimes there's misinformation out there, but if you hear something, go to your doctor and have the conversation, ask the questions.
Absolutely.
And speaking of doctors, what would you say to people who have lost trust in doctors? I can think of, right, I had my surgery back in 2021, and I remember I was about to go to a doctor to perform my surgery, but something said, don't do it. And this was a very reputable doctor. And then it came out that he had like 20 counts of misusing products. And there were women who had to get HIV tests, unfortunately, after that. So there's so much distrust when it comes to doctors. How do you make sure you are choosing the right doctor, especially when we are talking about something as severe as fibroids?
I think research, really talking and finding out who's a good fit for you. I would definitely caution against not doing anything. We talk to so many women who, because they have a distrust, they don't do anything, and realizing that fibroids can be quite dangerous. So because you don't have a trust in providers, then saying, well, I'm not going to do anything, that can be quite dangerous. Chronic anemia, you can really start to impact your heart health and your overall health. So really advocating, you deserve to feel well. Continue to advocate for yourself until you find that provider that you trust and find that treatment that works for you. So really just don't give up.
You're right. Do not give up. And as you mentioned, research is so important. Dr. Bates, anything you want to add to that?
I would just say, oftentimes there are support groups for women who have fibroids. So word of mouth, the word gets out about the doctors, the healthcare providers that actually did help these women and meet them where they were, and with what they wanted for their care long term. And I think, again, you vet that doctor. Don't be afraid to get a second opinion. And when you feel comfortable, that's it.
The women who you are treating right now, what are the conversations like?
I think an open conversation. I think a lot of times women don't feel heard. A lot of times you'll talk with doctors, and we know the medicine, we know the options, but a lot of times acknowledging the hard decision that a woman is facing, women want to be heard, and have that empathy for women. So having the conversation with them, listening to the woman, giving her the choices so that she has space to make that decision for her. Every choice is not for every woman. So giving her the time and space to really make that informed decision is really, really important.
And I'm glad you said that about listening, because I hear so many stories about women who go to the doctors and a lot of times they do not feel heard.
No. No.
I think as, physicians, we are really good at just blurting out a lot of information, right? Kind of, and expecting our patients to digest it. But I think when you really make sure they understand, you're spending the time with them to answer the questions, that goes a long way in having them actually feel heard and understood as well.
Is there anything else that you want to say or add? Anything you want to say about procedures that you would recommend, or anything else that you want to say to women who are suffering silently, as most women do?
Miss the opportunity to intervene in a less invasive way. So that's my biggest piece of advice for you.
We've seen those outcomes where the hand is forced at that point, where women have actually passed out from their anemia, or even women who have succumbed to this because of it. And so don't let that fear drive you away from the interventions. And then if you have questions, come back. I have women who have come to us multiple times to have the same conversation over again. We can have that same conversation over again to talk about the options again, so that you feel very comfortable with the information and very comfortable with the decision you're making.
I'm just glad you said that about conversations, because I can think about, 5 years ago, 4 or 5 years ago, people were not talking about fibroids. I feel like it's something that people are starting to talk about more. And really, the way that I found out that I had fibroids, I basically was looking like I was pregnant. I was
Sure.
back then a lot slimmer than I was, and people started asking if I was pregnant. And it took my mother, who was in North Carolina, and this was when I was living in Memphis. She said, "I think you have fibroids." And had it not been for that, I remember the doctor saying, "You could have died," because I waited so long. So can you stress the importance of having conversations? Because I think we don't have these conversations enough. And what happens is people, they bottle it inside. And then people don't know that maybe having that conversation really could save lives.
Certainly.
Sure. So I think just the continued conversations to increase awareness around what are the symptoms of fibroids. Unfortunately, when fibroids grow slow over time, you don't really feel a difference versus something that grows very quickly and rapidly. So if it takes years for something to change and that abdomen to start to stick out a little more, it's more subtle for you on a day-to-day basis. But when you I think know the symptoms, you look at your body, you can feel something's a little off, be seen, advocate to have the ultrasound, to get it ordered. So
And don't write off symptoms. Again, we are notorious for feeling poorly and being okay with that. It is not okay to bleed excessively, to feel tired all the time, not be able to go to work or school or do those normal activities. That's not okay. And so don't write those symptoms off. Demand that those things be worked up and evaluated.
Any final thoughts, any closing remarks?
I think at the end of the day, you've asked some great questions, and really, we would just encourage women to pay attention to their body, pay attention to how they're feeling, find great relationships with doctors that they trust so that they feel comfortable seeking good options should they have fibroids.
and have your annual exam. That's another opportunity that we find things. Oftentimes I find huge fibroids and my patient had no idea. So the annual is a very important exam and touch point as well.
Yes.
And if people want to learn more about your practice, can you tell us briefly about your practice and how we can learn more?
Yes. So we are Female Gynecology and Wellness. We're here in Charlotte, and we provide a holistic approach to women's health, traditional gynecology, but we also have dietitian services and also mental health services. We do your annual exam, but then we also treat any of your gynecologic conditions such as fibroids, endometriosis, heavy periods, perimenopause, any number of conditions. And we'd love to see you guys.
All right. Well, thank you so much. We have Dr. Parson and Dr. Bates. We really appreciate your time and thank you for being with us today and sharing so much important information about fibroid awareness and how women can seek help.
Thank you.
Thank you so much for having us.